Matters health, you know, the National Assembly and the Senate recently passed 4 bills.
Yes.
That's a bill on social health insurance, a bill on primary health care, FIF, and digital health. Now, the president also launched the primary health care basically on community health workers or community health promoters, in which you remember at Urubak the week before that, he was able to launch a distribution of 100,000 kits for the use by these community health promoters. And during the Mashujaa Day in Kericho, he officially launched now the work for which the community health promoters are supposed now to carry out within our village.
Yes.
These are key workers in as far as healthcare is concerned, because what the government is now trying to focus on is primary healthcare. This is more to do with prevention, promotion of healthcare, and see how best we can be able to combine that with the curative healthcare, which has been there, that has been emphasized since independence. So now that this is already, with the laws are already in place, what we need now to look at is that the regulations to operationalize them are also going now to be put in place. And what you've seen currently in the budget, which is the supplementary budget, which it is tabled in the National Assembly, which the committees are now working on, is that the president has tried, especially on the health sector, now to align the supplementary budget to fit into this primary health, the bills which are now in operation as far as provision of universal health care is concerned.
Lofty, niambie uko sawa sasa?
Niko sawa. Nafikiri nimependa jinsi alivyoelezea, lakini naomba kumleta Mheshimiwa Mbadi kwa sababu mwenyekiti wa kamati ya afya bungeni ameeleza baadhi ya hatua ambazo serikali ya Rais William Ruto imepiga katika afya. Na katika mwaka huu mmoja wa serikali ya Kenya Kwanza tumeona mengi mheshimiwa ambayo yamefanywa mabadiliko. Moja ni hili la afya. Wizara pia baraza lake la mawaziri limefanywa mabadiliko, moja kahamishwa kutoka hapa paka pale, mwingine huku paka kule. Lakini tumeona pia mengi ambayo yamejitokeza na watu wakitaja kwamba ni masuala ya ufisadi. Kwa mfano, Margaret Nyakao ambaye ndio msimamizi wa bajeti juzi alitoa zima akasema kwamba shilingi bilioni 1.5 huenda zinapotea kwa kuongezwa mishahara visivyo, ulagai pale. Mbali na sifa ambazo ametoa kwamba zimepigwa hatua, je, wewe unaweza toa asilimia ngapi kwa haya yote ambayo yamefanywa na serikali kufikia sasa ndani ya mwaka mmoja mheshimiwa?
On issues health, yes, I admit that we have passed a number of laws, 4 of them in the recent past, to focus more on prevention. And I want to agree that prevention is better than cure. But we need to be clear on the funding of this model and ask ourselves, is health devolved or not? And where does counties come in? I think we need to be clear and give counties capacity to handle primary health care. If we think we can do it at the national government level, then we are again now compromising the very essence of devolution. So much as we would want to support the counties in terms of policies, we need to also be clear in terms of operation and implementation. How does the counties come in so that we don't fight the structure of our government? And again, we need to ask ourselves, how are we funding this universal health care, or the primary health care and the entire health system? Where is the money coming from, especially in this tight budget? We have again raided the pockets of employed Kenyans much more, which I think is not very helpful, much as it may provide some money. But what systems have we put in place to ensure that there is efficiency and prudence in management of these resources? Changing the organization, the NHIF, and changing it does not automatically bring prudence, bring integrity, bring transparency in that line. So that a lot needs to be done, whether through regulations, but more needs to be done in terms of showing leadership in fighting graft. Talking about the changes that the president made, I still want to go back to the time when the cabinet was approved. My comments, my sentiments are on record. I have had very little faith in Ruto's cabinet. I still have very little faith in the cabinet. I don't think the solution is in targeting one particular CS, whether it is Kuria or who. The bottom line is, does Ruto have a competent cabinet? Look at the way our economy is behaving. We are 15 months into this leadership. We cannot still continue with excuses. We must now find a solution to challenges facing Kenyans. The challenges facing Kenyans, some are external, some are internal. But the quality of leadership, the competence in leadership, is demonstrated during times of challenges, like the one we are facing. So the president needs to convince us that his government is up to the task. Look at, I would mention, in terms of our economic state of affairs. How would you know that the economy is healthy? How would you know that our country is doing better? You'd know it through certain parameters. There are certain parameters that you have to check on. One of them is the interest rates. Interest rate is rising. Even the premium treasury instruments like treasury bills and bonds are now trading for upwards of 16%. Therefore, banks will definitely charge you higher. There is the issue of exchange rate, the free-falling shilling. We are being told there's nothing that can be done. Then why do we elect you into office? Why do we have you in office? Why do we have you in treasury? Why do you have you in the central bank if you cannot bring monetary policies that would help which check the Kenya shilling, the way the Kenya shilling is weakening against hard currencies. We can talk about other issues like inflation. The inflation we have today is contributed by or driven by non-food items, like fuel and energy costs. If we were not lucky to have the rains that we have had, this country would be facing social disorder.